Hello, welcome to our chat. Or maybe I'm not going yet. I'm live. Okay. Welcome to our chat on stress urinary incontinence. I'm just going to wait a minute or two. It's 11:59 and then we'll get started. Okay. Hello, welcome to our chat on stress urinary incontinence. My name is Linda Cusick. I'm a physical therapist at Physical Rockville. I am a pelvic floor therapist, so I treat all conditions of the pelvic floor for both men and women. I welcome you today to our chat. I'm going to start with just some common questions and answer those. And if you have questions, you can place them, I think, in the chat boxes. Okay. Okay. All right. So what is stress urinary incontinence? All right. So incontinence is the leaking of urine at any time that you didn't intend it to leak. Okay, so unwanted loss of urine is incontinence. Whether it is a drop or whether it is a flood, it is considered incontinence. Stress incontinence has to do with when the pressure above your pelvic floor is greater than what that structure can hold, and you kind of get a giving way of that pelvic floor. So this is the pelvis, okay? And this is kind of how the pelvis would look in me, okay? Pelvic floor, let me come back up here, are made of muscles that almost form a bowl at the base of the pelvis, all right? So when I think of my core, I am thinking of my diaphragm, which is located under my rib cage. My abdominal muscles in the front, my back muscles in the back, and my pelvic floor muscles in the bottom. And it almost forms a canister that absorbs pressure or mediates pressure. So in stress urinary incontinence, the pressure within my core exerts a pressure down, and the pelvic floor muscles or the structure has laxity or does not respond the way we need it to, and you have some giving way and you have a little bit of leaking of urine. Right? So is it normal to leak? I'm off a little. When you cough and sneeze? No, it is not normal. So some people just assume that's the normal, like, oh, that just happens, but no, that is considered stress urinary incontinence. Okay, it is prevalent among women. It affects an estimated 15 million adult women in the United States. Is it only seen in women? That's another question. Sometimes no, it can also be seen in men. I commonly see it in men after prostate surgery, but also can see it in men that do not have prostate surgery. Again, it has to do with my core absorbing pressure so that it's not putting pressure on that bladder and giving way. All right. So what are things that are some causes or things that make more common with stress incontinence, leading to stress incontinence? It is more common in people that have gone through pregnancy and childbirth, but there are many people with stress urinary incontinence that have never had children. Injury or trauma to the pelvic floor, previous surgery in that area, pelvic surgery, excessive coughing and sneezing. I've seen patients that have COPD or have conditions where they're coughing all that time and that continual pressure down on the system, okay? And weakness in the pelvic floor muscles or laxity in the structure of the pelvic floor, such as some organ prolapse, right? How do physical therapists treat incontinence? All right. Physical therapists who have had specialized training in the area of pelvic floor can assess pelvic floor function. So we are looking at the muscular support and function of the pelvic floor and the core muscles. Okay, and how everything interacts. So we look at the strength of the pelvic floor muscles. Can they tighten? Can they relax? Are they relaxed at rest? Do they quickly tighten? Do they quickly relax? Do you have endurance? Can you hold those muscles and keep them tight for a period of time? That's one thing we look at. We look at laxity in the structure. When we cough and sneeze, do we feel things bulging? Do we see things bulging? We look at the core. Do you have a separation in your abdominals? Do your abdominal muscles, contract? What is the strength? How does all that work together? And breathing, how a person breathes. So when I breathe with my diaphragm, okay, my diaphragm again is here. As I breathe in, that diaphragm drops down and my lungs fill with air and my rib cage expands laterally. All right. When I am breathing, my diaphragm here, my pelvic floor here, as I breathe in and my diaphragm goes down, my pelvic floor relaxes a little bit, and as I exhale. So this is kind of the motion of my core. So a lot of times we look at rest, and when a person's breathing, are we getting the response or the movement that we think we're supposed to, kind of how that all works together. So it's not only pelvic floor strength, but it's how it all integrates with the core. And what we need those pelvic floor muscles to respond and create force at the moment we need that force and relax when we don't. Right. So another question, what are some lifestyle changes that can affect incontinence, just urinary incontinence? Chronic constipation is something that's a comorbidity a lot of times with incontinence. Just takes up space, puts increased pressure on the bladder, changes the mechanics, kind of. So, to address incontinence, you want high fiber foods. Constipation. To address constipation, you want high fiber foods such as grains and fruits and vegetables. And a lot of times treating constipation will help with the incontinence and get rid of the incontinence. Also, when people are overweight, that increased excess weight puts increased pressure on the bladder, pelvic floor muscles. Obviously, those muscles are going to have to be stronger to counter all that force. Also, faulty breathing mechanics. When people are big chest breathers and they're not using their diaphragm adequately, that is sometimes a common comorbidity we see. I've even seen people do things when activities of daily living and breath holding. So people who are always breath holding for stability increases that pressure on the pelvic floor. Okay. Can incontinence be the sign of something more serious? Yes, it can. It is good for people who have something like, I've never had incontinence before and now I have incontinence, and to be checked out medically, because there are a lot of underlying medical conditions that can impact and lead to incontinence, and it's always good to have those things ruled out. Things that you need to see the doctor immediately for would be like severe pain with passing urine, weakness, loss of sensation in the legs, trouble speaking or walking, tingling in any part of your body, loss of vision, confusion, things like that, loss of consciousness, and loss of bowel control. All those things would be an immediate, I have to see the doctor, that, if continence is associated with any of those. Who should be referred to people or therapists who treat incontinence? People who are having leaking with their activities of daily living, people who leak with coughing or sneezing, people who frequently urinate throughout the day, have a lot of urgencies, people who can't get to the bathroom without leaking, and that's another type of incontinence. And there are multiple types of incontinence today. We've just talked about stress urinary incontinence. There's other types of incontinence such as urge incontinence, overflow incontinence, all loss of urine, just a little different mechanism. So if anybody has any questions, they can type them in. Oh. All right. If any, of intake of caffeine and taking hydrochlorothiazide for so yes, so caffeine is a bladder irritant. Okay, so bladder irritants make people pee more frequently. So things like caffeine and alcohol tend to make you pee more. They're diuretics. Caffeine and alcohol are diuretics. Bladder irritants are certain types of foods. Sometimes spicy foods will make people pee more frequently if they have a real sensitive bladder. A lot of carbonated beverages will be a bladder irritant. So when people have frequency and urgency, a lot of time taking caffeine out of your diet, reducing carbonated beverages can make a difference. As far as high blood pressure medicine, if it is a diuretic, it will make you pee. So it's normal to have more frequency of voids after taking blood pressure medication. So that's common. That doesn't necessarily mean stress incontinence, because stress incontinence really is more related to the structure and muscular function and has to do with the pressure above. But the caffeine and the medications will make you pee more frequently and may impact urgency. Are there any other questions out there? Well, I don't see anything else coming in. I thank you for joining us today. If you have any additional questions, you can always reach us at Physical Rockville, and I think we're typing into the page how you can contact us with any additional questions. And thank you for taking the time to join us today. Okay. All right. Bye-bye.